So my name is Jasmine, and I go to Queen's University of Charlotte. I'm a junior right now, and my first major is psychology, my second major is English, and my first minor is professional writing, and my second minor is history. I had to be hospitalized because I was repeatedly assaulted and I was dealing with the effects of PTSD. And although there were some aspects of the healthcare that I received that was really good and has still helped me to this day, this was about late November, but there are also a lot of things that are really, really bad. So when I first went to the hospital, I went there because it was like the only mental health facility that I could find while looking online. And then when I got there, it was really like scary and like not comfortable, and so I asked to be transferred to another one. And so they sent me to one in Davidson, which was really nice. Throughout the whole thing, they didn't tell me anything about the price. They didn't tell me about the cost. They didn't tell me about insurance. Not once.
Really?
Yeah. And so when I got out, I received a bill for $40,000, which I could not afford. And I still have that bill that I have not paid because it's $40,000 and we're trying. I think it's especially painful, like, you know, if you're already mentally ill, if you're already mentally unstable, and you're already dealing with these problems in your life, and then on top of that, if you're mentally ill because you were assaulted and you have to deal with all of this pain every day and trauma, and then it's adding to your trauma that like you have anxiety, that on top of all of these things you need to figure out within you, that you also have to figure out what are you going to do about this $40,000 bill that you didn't know you were going to get. And so the reason I was billed $40,000 is because I have insurance. I do have insurance, but the hospital that I went to was out of my network.
Got it.
So I went to an Atrium hospital.
Mm-hmm.
And if I had gone to a Novant hospital, my insurance would have covered it.
The whole thing?
I don't know if the whole thing, but they would have.
Okay.
They would have helped. It would not have been a $40,000 bill.
And they should have communicated to you.
They did not once tell me, this hospital is not in your network and you should be transferred to another hospital. It means not getting the resources that you need. It means the system is one in which it makes it difficult to pay for. So when I was looking for a mental health care facility, it was very hard to find one, and it's on top of that very hard to find what fit what I needed. That there's so many hospitals that you could go to for all of these different problems with your body, but there's very few resources that are meant to address mental health care.
So, as a victim of sexual assault, you don't feel like there was adequate resources at your disposal to help you really feel better?
Yeah, that's
Okay.
exactly how I would put it. A lot of healthcare facilities focus on people whose mental health has become so unstable and so severe that they are like in need of urgent like healthcare, rather than people who might be not in extreme danger at that moment, but in a little bit they will. Or so like they're, you know, it's not a preventative system.
There's no focus on helping people maintain their mental health. It's just when you get to a certain point.
Yes, that's exactly it. I think one of the biggest problems with healthcare is that it's not preventative. That it's after something bad has happened is when they try and help you, but there's very few things in our society that is promoting preventative healthcare. I think that when you're in a regular healthcare facility, like with a physical issue, they assume that you are in the right state of mind to make decisions for yourself. And so in a mental health care facility, you know, like some people might not be in the state of mind to make the correct choices, but some people can be. Some people are like, I'm coping with pain and trauma, but I'm still capable of making choices for myself. So I understand why some people, you know, maybe are not able to be in full control of what they receive, because maybe they wouldn't be able to choose what's best for them.
Yeah.
But then still at least to have a voice, to at least be able to say, this is what I would like. Can you keep that into consideration? Can you evaluate my mental health, determine that I'm capable of making decisions for myself, and keep in mind, also, if I'm a psychology major and like I know a little bit about psychology, my own personal psychology, that like I know that some of these things are beneficial for me. Could you provide that?
Yeah. And that you didn't have that autonomy in a mental hospital.
Yeah, I would say so.